And it's time for our weekly segment, The Doctor is In. And joining us now is Dr. Ira Zunin. He's with Manukau o Malama Integrative Clinic, and he's a doctor of preventive medicine. Good morning, Dr. Zunin.
Good morning, Mahia.
Thanks so much for joining us. Now, this morning we're talking about cell phones, potential risk of cancer. And of course, everybody uses a cell phone these days. And without scaring people, is there a real hard evidence that using your cell phone causes cancer?
Well, I would say the evidence is mounting. We're seeing studies in Australia, in England, that really point to the possibility that there is a real risk of cancer with a cell phone.
And what kind of cancer are you talking about?
Well, it's most often brain, and it's most often on the side of our head that we use the phone on.
Mm-hmm. And this is because of the waves, or what is it causing?
Yeah, I mean, it's actually microwave electromagnetic radiation that can disrupt the DNA and the cells that are closest to it and create a problem.
Right. And so is it possible just to, use one of these earpieces and, take the microwaves away from your head?
That's a good question. It depends upon the earpiece, but most of them still require electromagnetic radiation to get the signal up there, such as with Bluetooth. So there may be some reduced risk, but it doesn't make it go away altogether.
Right. So, I mean, we're not going to get rid of our cell phones because of these studies. So, what can people do?
Well, I think the first thing is to make sure if you're calling, you really need to make the call, and you're not forgetting just to realize that your feet are on the aina. Another thing is to break the habit of using our cell phone in the house, in the office, when we actually could use a landline. Remember, Europeans do a lot with text messaging, and we could probably do more here in America.
And really quickly, changing subjects right now, we've been talking about VOG and sulfur dioxide in the air. And during the commercial break, you said that you're seeing more people come into your office with health problems because of the VOG now? Yeah,
we really have. Since the last eruption, I guess a couple of months ago, and the wind patterns, we're seeing a lot of patients, dry, red, itchy eyes, runny nose, congestion, feeling kind of weak and run down, and also those that already have asthma or emphysema are having a harder time.
Right. Well, we can't stop the eruption, so what can people do if you're just kind of feeling sick and run down and that cough just doesn't go away?
Well, I think a lot of benefit is just laying low and not being out, not sucking up a lot of extra air that you don't need to, staying indoors on the really bad days, staying with the medications that you need to be taking.
All right, Dr. Ira Zunin, thank you so much for joining us. We really appreciate it. And we'll see if we get a call from you later, and the doctor is in.
Very good.
And stick around. We'll be right back after the break. You're watching KITV4, your Island Television News this morning.